Hi everybody, welcome to Smart PT. This week I'm going to be talking about how to perform a proper biomechanical examination and what we do with the information after we've done so. So if you want to check the flow chart, I'll be discussing the components of the biomechanical examination step by step. When performing a biomechanical examination, we take the findings that we had received from our active range of motion and passive overpressure testing. From there, we determine whether or not a joint appears to have a restricted range of motion or an excessive range of motion. So we want to test a little further to try to figure that out. I like positional testing. Some people no longer use it, hence the plus minus on the flow chart. Positional testing is basically just feeling where the joint is sitting in space relative to joints above and below and potentially on the adjacent side. Then I move on to kinetic testing. Kinetic testing is basically watching the joint move as the person moves their body actively from above or below the segment, just trying to see how the joint moves. Does it seem to open and close properly, translate properly, or is there apparent restricted motion? Now you can't rely too heavily on those two tests to tell you whether or not a joint is moving appropriately or not, but they are very nice tests to kind of quickly zone in on a target area. From there, I'll be a little more specific about movement into different quadrants through passive physiological range of motion testing. In the extremities, that's referred to as passive physiological movement, and in the spine, it's passive physiological intervertebral movement. From there, we usually have a pretty good sense whether a joint is hypomobile, seems to have normal mobility, or is hypermobile with excessive mobility. Depending on those results, it'll determine where we go from there. If the joint is hypomobile, I would progress to passive accessory motion testing. This is joint play, basically. It's referred to as passive accessory motion in the extremities and passive accessory intervertebral motion or movement in the spinal segments. After we do our passive accessory motion tests, we'll either find that the joint seems fairly normal in terms of its joint play, and that would indicate that it's most likely a myofascial restriction, or we would see that the joint is restricted in its mobility, which would suggest more an articular restriction. And that would determine how we would treat that particular segment, either through muscle stretching and muscle release techniques, possibly IMS or functional dry needling, or if the joint is more at fault and it's an articular restriction, we would potentially consider using manipulation or mobilization techniques. In the case of excessive or hypermobility, we would progress to stress testing. These are non-physiological motions, so stress testing tends to be pure plane movements that don't normally happen. AP, PA, lateral, or rotational in a pure plane that you wouldn't typically expect. And you're looking for late or absent end feels, which would suggest that there's excessive mobility and possibly instability. If you do these tests and you find that there's relatively normal mobility, then it may just be the case that the client is just somewhat hypermobile. In that case, I would move on to more muscle testing of length, strength, recruitment, other special tests possibly. And then your plan of care for these individuals would be stabilization, whether it's excessive mobility or more on the hypermobility side of things. It's stabilization through core training or specific joint muscle training, potentially external bracing if needed. However, I do typically prefer to try to get the individuals to train their own muscle recruitment patterns to stabilize their joint. So basically the purpose of this testing process is to find out, is it stiff and restricted? And if so, you mobilize that area to try to regain that mobility and movement, or is it unstable or hypermobile? And if that's the case, your treatment plan is going to be geared more towards strengthening and stabilization, either externally and or internally. I hope you found that information useful and interesting and that you can use it in your daily practice. For more information, more videos, check us out on Facebook.